be next to share screen, Devin?
Yep. So the meeting is now being recorded. Okay, didn't want to forget that. Okay, so let's have a look a little bit at the agenda for today. I don't want to take up too much time. I want to reserve the time for the speakers. So this is what our agenda looks like for today. First of all, Jurgen is going to speak. You're going to talk to us about short-term forecasting of coronavirus. Jurgen is a James Martin Fellow at the Institute of New Economic Thinking at the University of Oxford, and he's been working and doing some recent research in this area. And I look forward to listening to the research. I think there's a bit of a paper out on it as well, so I'm excited to hear what he has to say. We also have with us Trevor Sidery, who is the lead data scientist at Tesco. I think he's mentioned to me that he's been working there for about 6 years or so, and now he leads the area of forecasting within their data science team. So again, the idea is that we have a bit of a research talk and a bit of an applied research talk in a real context. That will be followed by a question and answer panel with Trevor, Jurgen, and Jennifer Castle, who's also associated with, I think, the research effort being done by Jurgen and his team. She's a tutorial fellow at Oxford and a member of the climate econometrics group, I think. But I'll get each of them to say more about themselves as we go along. We then have at 3 o'clock a social quiz. So the idea is that for this first segment, which will last an hour, it will be recorded. And after the segment, we would invite people. Often a part of this meeting is a bit of a social gathering. This time around, we're going to have an online quiz. We're going to go into some breakout rooms, some Zoom breakout rooms, and we're going to have some stiff competition to see who will be crowned champions. Probably can say more, but what I would like to do, because we're already behind time, I would like to pass you over to Jurgen, who is going to introduce himself and then, of course, begin his talk. What I would appreciate, and it seems everyone is already doing that, when the speaker is speaking, that you keep your mic on mute as far as is possible. The speakers are going to speak for about 15 minutes, and then you will have an opportunity to ask questions. There will also be a Q&A segment. So in other words, there will be plenty of opportunities to ask questions, but I would ask that the speakers be allowed to finish their talk, and then we get questions after, okay? All right, Jurgen, how does that sound? Are you ready for your talk? Let me stop sharing here. Yep, okay, so over to you when you're ready to share your screen and to begin your talk.
Need to unmute Jurgen.
Yes, okay, start again. Sound is useful. Thanks very much for Devin for inviting me and for organizing this session. I will now start sharing my screen, and then I will talk about the paper that I'm presenting. So start broadcast. Okay, can everybody see this?
Yeah, thanks.
Okay, excellent. So this is a paper about short-term forecasting of the coronavirus pandemic. It is joint work with Jenny Castle and David Hendry. We're all in Oxford, and we're all associated with climate econometrics group at Oxford as well. It's a short presentation, so I will skip out all the mathematics. And just present, give an overview of what we're doing. So it's needless to say that the COVID-19 that's going around, the pandemic, is having a major impact on the economic and physical well-being of all of us. And one thing that we've been doing is making real-time short-term forecasts for confirmed cases and deaths for many parts of the world. When we started in March and April, the epicenter was in Europe. Since then, it has shifted to the Americas, where it is now, and we see a resurgence in the US. And to be honest, one forecast that I had wrong at the beginning is that I didn't expect that by now we would still be producing these forecasts. So hopefully we can stop doing that before too long. Because it's been more than 3 months now, we've made about 63 daily forecasts for more than 100 regions. So it's a lot of forecasts that we generate. Our forecasts are based on the data gathered and supplied by Johns Hopkins University and the CSSE. And for a period when the US states dropped out of their system, we used the New York Times data for US states, but then they messed their data up and we switched back to Johns Hopkins data, which had reintroduced the US states. So there are many data issues, there are many quality issues. I won't spend too much time on that because we just take the data as given and we just try to make the forecast with what is supplied to us. So as I said, the aim is to produce short-term forecasts. In our case, that means 7 days ahead. The methods that we used are based on models where what we call saturate the sample with all possible time trends. So when we have a saturated model, we have more variables and observations. So we need to use machine learning type methods to get estimates. And that is what we do. And effectively, we take windows of the data, saturate these with the trends, then get an average trend that is estimated. And in that way, extract the trends from the data. Seasonality we ignore, although actually with hindsight, we can see that there is some daily seasonality in the data as well. Then given those time trends that we have estimated, we use the forecasting method that we developed for the M4 competition to create the forecasts. Well, in short, this method produces decent forecasts for the week ahead. And it has, when we have done comparisons, it has produced better forecasts than many of the epidemiological models that are used to create forecasts as well. So one question is that why? Our models are purely data-based. We don't build say a compartmental model that is often used in epidemiology, but we purely use recent history to create forecasts, and this works well. And this may be a surprise to some, but it's also a bit of a stylized fact that quite often simple data-based methods outforecast structural models. And there are several reasons for this. Is that sometimes these structural models are very simplified. They're driven by only a few parameters. They may be highly nonlinear, but also they are very sensitive to shocks that happen and shocks that change the distributions, that change the equilibrium, and then the models, that the rigid models may try to return to the wrong equilibrium and in that way fail to forecast. That doesn't mean that the structural models are not useful. On the contrary, they are very useful, but often it seems to be the case that they are more important to try to understand what has happened in the recent past rather than trying to forecast what happens in the near future. And once again, there's many reasons for this. There's problems with the data. As we will see, sometimes there are negative numbers, which theoretically shouldn't be possible, but also there are many changes. There are policy shifts, lockdowns are introduced, lockdowns are relaxed, people may adhere to the lockdown or they may not. All these things create non-stationarities in the data, and the data are regularly revised as well in a way that may also be non-stationary. So what we bring to the table here is methods that try to be robust and flexible in sample, but quite restricted out of sample. So in sample, we can control overfitting. It's not an issue at all. But out of sample, we want to be very careful. So we use a much more restrictive forecasting methods. And in particular, we try to dampen trends. Although in this case, the trends, of course, can be exponential. So we don't want to dampen them too much. This is, we have written, well, we have a website, which I'll refer to, where we regularly produce these forecasts. As I said, that's updated 4 or 5 times a week. And on that website, there's also 2 papers that summarize the methods that we have used. Now, we started data collection in March. And, well, actually, in those days, at that point in time, there weren't very many forecasting models at all. By now, there are very many groups around the world that produce forecasts. I noticed that Photios is here. He is someone who worked on forecasting before us. But as far as I know, apart from that, we were one of the few early ones to start this daily forecasting. So, well, just a bit of looking back at what the data was. We have confirmed cases, as I said, the Johns Hopkins database on the left, and we have the count of deaths. So these are cumulative counts. We always work with cumulative counts on the right for 4 countries, the UK, the US, well, the EU, it's not a country, it's all the 27 EU countries, and Italy as well. So early on, these were regions that were of particular interest. And of course, we remember, as we may remember, the data was growing very rapidly in different ways. So countries were behaving differently, and that was the type of thing we were trying to forecast and the type of thing we try to model. So clearly, very different behavior between different countries. And if we just quickly look at what it looks like now, then we see that it's gone up, particularly for the US and the EU in aggregate. It has gone up a lot since those dates. The US is still, after a slowdown, accelerating. We also see some strange things. We have negative deaths in the EU data, and actually that's not just there. We've seen that from time to time, which of course is very nice if that would be really the case, but unfortunately it's not. We also see a little bit of seasonality, which we actually ignore throughout. And to be honest, I didn't expect that we would see seasonality in the data at all. If you have sharp eyes and you look at the transition from the short run, the short span of data to the most recent data, you see that the blue lines and the red lines, so that is the US and the UK, don't line up. And that is revisions. We know for the UK, death count was revised, the history of death count was revised by including deaths in care homes, which at first were not included. So these things matter also when it comes to evaluation, because when we make the forecast with the old data, and then we evaluate it against the new data, that potentially creates a problem. So now a look at what we do. So here is, and this is, I'm going back to April, because for most European countries, that was when the steepest growth was. That was when the really important decisions had to be made. What we see here in this graph is the outcome for the UK up to the 15th of April. That is the solid gray line. Then we see the estimated trend in the dashed line, and we have 4 forecasts made from different days. So we go 3 days back in time. This is to try to kind of capture changes, monitor changes in these exponential trends as well. So then the forecast that our main forecast is the last one of these. So that's shown in red here. So that is our forecast. So in this case, we forecasted that confirmed cases would go up by about 50,000 in 7 days. And we have our forecast interval as well. And then we create the average of all the forecasts that look at the last 4 days, and the difference between those tells us a bit that in this case there's a slight slowing down, but of course that's all within the forecast intervals, so that may not be statistically significant. And then we can add in what happened, of course, afterwards. We do know that, and then we see that we have an over forecast looking backward of about 10,000, which as a percentage is not a very big number. Well, one of the things we talk about is robustness, and that means that we need to be able to recover from a break. So here you see Italy in March, early March, so very early on. Of course, Italy was the first European country where the coronavirus hit really hard, and we see effectively a trend break on the 7th of March, which our forecast method misses, which is not entirely surprising because it will take some time. But the idea is that yes, we miss it, but we also do want to recover from these kind of mistakes. And then if we go 1 day further, we see that our forecast has indeed recovered from that break in the trend and is now following the data. Well, of course, the data is added in afterwards, is now tracking the data very well. And we see then in that case, because of the trend break, that the average forecast, which is in black, trails behind the actual forecast. And then we can take that one step further. So we can track our forecasts in these types of graphs where we just follow the evolution of the forecast and see how well that tracks the data. Well, we of course, the big question is, because we come to this with a purely data-driven model, which in some sense doesn't tell us anything about what is R, or what is the demand for intensive care beds, say. But the question is, so what does it bring then? Is there anything useful? So how valuable are these forecasts? So we did fairly extensive forecast comparison with the first one we looked at is the one you've probably all heard about in many different ways, is the Neil Ferguson team at Imperial College, which is producing forecasts, but they only produce forecasts once a week, 1 week ahead, and they started this quite a bit later, and possibly because the models are quite computationally intensive, these forecasts are often published with a delay of 3 or so days. But because we want to forecast like with like, we have 104 cases where we forecast the same countries for the same period. And then we can compare our forecast errors. And if you look at the mean absolute errors for the period of early April, RF, which F is our forecast, the mean absolute error was substantially smaller, even up to 1/3 of those of the Imperial College group. And if we look at the mean absolute percentage error as a percentage of the total, or the mean percentage error, we see a similar thing. So basically by now, when everything is very steady, the forecast quality of the models is very similar, but during that period of exponential growth, where arguably it matters most for policy, our forecasts were substantially better. They were also, and that's the last column, the mean percentage error, much less biased than those forecasts. In addition, we have compared forecasts to the Institute of Health Metrics in Washington, and with the Los Alamos forecast, and and particularly looking at the US data, and again, our forecasts on the whole are a bit better, not quite by these kind of margins, but a bit better than those models. So there seems to be value of having this type of approach to the forecasting, to create forecasts as well. Another thing we look at is looking at when the peak was, and that really needs a lot of smoothing, because effectively you start looking at the change in the daily increments to know where there's a peak. So we need to do lots of smoothing, and from that we can, looking backward, we can create estimates of the peak, which is creating tables, which I actually think are very interesting, because knowing when the peak was and whether it stays there is really very useful, and that's a warning if a potential second wave comes across. So we see here, and this is something you can on the website, on the 20th of April, you see that we've estimated the UK peak in deaths to be on the 10th of April. That was after the data revision. Before the data revision, it was the 9th of April, so no substantial change. The US also had a peak, and it still has a peak, but if we look at the number of confirmed cases, then we see that if we look at the changes in these estimated peaks, that for the US, we established that there was a peak on the 9th of April. Well over a month later, that peak was still at the 9th of April, but now that peak has gone, and we saw that in the earlier graph, that there seems to be a re-acceleration, which is something to which our forecasting methods adapt really quite quickly. But that's of course rather unfortunate as well. We'd like to see peaks everywhere as soon as possible, and we really don't want to be doing this at all, to be honest. So given the time, I will kind of skip over this, just to say that we have another way of creating forecasts, which is based on what happened in China very early in the year. And we try to see if that can also be used for forecasting. Again, it's a situation-based estimation. And actually, for deaths, that produces very good forecast. And that is something that potentially could be used to forecast further ahead than the 7 days. What we do, we really don't want to take much further ahead than that. So to conclude, forecasts are very important because we need to make decisions. We need to decide how to, well, ideally at least, we decide what we need to handle what's going to happen in the week ahead. And our forecasts are complementary to epidemiological models. They are by no means a replacement, and they don't provide the same type of estimation or same type of insight of what has happened. But for forecasting purposes, they seem to be valuable. They seem to be more accurate. They are more robust because we don't need to handle, say, negative counts, which is something the data, epidemiological models would need data messaging to be able to handle that. So there is a point, we think, in producing forecasts these ways. They're all on our website. Please go ahead and have a browse. As I said, I've just updated it again today. And the links to the papers are there as well. And of course, comments now or comments later are very welcome. So thank you very much. Okay. Kind of reasonably on time.
Yeah, not too bad. I just hi you again. Yeah, I just thought it would make sense for you to just go all the way through, rather than give you any sort of time reminders. Just so that the entire presentation was recorded seamlessly.
Yes.
We're a little bit.
But you didn't tell me in advance, because then I could have taken a few hours. But,
yeah, I mean, we still have time for maybe 1 or 2 questions. I know we're struggling a little bit behind time, but if we have anyone in the audience who would like to ask a question, if you could type H in the chat area or something, and then feel free to turn on your mic and to just ask the question directly of Jurgen. That would be fine. Is there anyone who has a question on the presentation?
Well, predictably,
Hey,
possibly.
hi, Robert. Go on.
Hi. Yeah, just about lead times. You've emphasised the 1 week ahead lead time, but what about longer lead times?
Well, we think our models are not appropriate for going further ahead, so I haven't really looked into that because I don't think there's anything in the models that we use that would predict a slowdown further ahead or can respond to anything that has happened, like policy decisions. The path forecasts, the scenario forecasts are an attempt to do that, but we've not really pushed that further than 7 days ahead.
Okay,
Devin, I have a quick question for Jurgen.
Okay, sure.
Just to ask, to what extent have people been contacting you and asking about your forecasts? And has anybody from any of the government agencies been following up on that?
Well, we've had some, not a huge amount. The Latin American Development Bank has been very interested in our forecasts, and obviously forecasting for Europe is not so interesting at the moment because it really is all fairly stable. But for Latin American countries, it's really very important, and so they have been monitoring and they have been looking at it. And next week I'll give a presentation in Brazil as well, because particularly Brazil at the moment is very obviously there's a lot in the news and is very interested in these kind of forecasts. And I think for Brazil, the feeling there was that at least that our forecasts have been more accurate than some of the other forecasts that have been available for Brazil.
Okay. All right. I think we're going to have, I'm sure we probably have a few more questions, but we're going to head over to our other speaker. And we should still have some time for our Q&A panel, obviously. So if you remember the question, you can ask it later on of Jurgen. Okay. So let me hand things over now. Trevor, how are we?
Yeah, good.
Yeah, good to go. So
yeah.
Over to you to load up and.
Great. See if this works.
So again, before we continue, again, thanks, Jurgen. Thanks for that. Very informative, and we'll come back to you with questions shortly. Yeah.
Hi there. Sorry, I just got kicked out. I'm back now. Thank you.
Great. Can everybody see the slides now? Is that working?
Not yet.
Yeah. Not yet. Let's try something else. Is that better?
Much better, yes.
Yeah, you're good to go. So if you can make it slideshow full screen.
Yeah, I'll sort that out now.
Yeah, awesome.
Still good.
Great.
Fantastic. Great. Yeah, so we'll be talking about forecasting in retail. So I work for Tesco. I guess got particularly, industrial focus, which is good. Also, the other thing that's probably slightly different to the previous speaker is that I'm in this talk particularly concerned about longer term forecasts. For anybody, I wasn't quite sure if everybody in this call would actually be from the UK, given that it was online, but just as the brief overview, of course, Tesco is a large grocery retailer. There's about 3,500 stores in the UK. Also stores around some of Europe and Asia and a few countries, and then about 400,000 or more colleagues worldwide. So it's kind of the size of it. The other bit I haven't written down here is we've got a reasonable online presence, so grocery home shopping. I guess lots of you will see our vans going around along with everybody else's. So I particularly the stuff that I work on is not the, so we have supply chain who fundamentally worry about getting food and other products into stores and making sure that the stores are stocked, and they're of course worried about this kind of short-term forecast over the next few days to a few weeks or something like that. I work with much more with the finance teams who are worried about things like making sure that I have enough people working in the stores, and for that and for payroll the lead times are a bit longer, so the length of my forecasts are a bit longer. Now, just to kind of, I guess, how briefly how we typically have to worry about forecasts as compared to what's currently happening. We typically forecast our sales to our stores and groups of products. Here I'm just worrying about groups of it rather than every single product. As I say, it's kind of long-term forecasting, so months out to a year type thing for budgeting purposes. In the past, we've been able to rely on reasonably standard forecasting techniques, I would say, as long as we have some idea of a trend, a seasonal pattern, and then some ability to model events, we can do a reasonably good job. And especially if the more forecasts you're trying to produce, having a simple model works quite nicely, and there's no need to necessarily get much more detailed if you don't need to. So on the right, I've just made kind of all of my graphs here are cartoon graphs, by the way. None of the numbers say anything, but they're just to pictorially show vaguely what's going on. So here, for instance, you might imagine this is the sales from a Tesco store. The large peak there would be Christmas each year. There'll be some seasonal trend, as like in the summer, for example, people need to drink more fluids because it's hotter, and so you get increased sales from that. Similarly, there'll be events like Easter or something which you have to worry about. Maybe they'll move around, so you have to do a bit of it's not just worrying about they fall out of the seasonal pattern. You actually do have to worry about events, but still not too troubling. And then what we then do is we basically are able to run these models in a centralized system where we actually allow judgmental adjustments. So this is our mechanism by which we can get expertise from different parts of the business that can feed into our forecasts and provide those missing bits of information. So like, for instance, roadworks outside a store or something like that. Our forecasting system is also the method by which people are interacting with the forecast. So they, we produce the forecasts, then that's the mechanism by which people can see these forecasts, maybe make some judgmental adjustment suggestions and feed that back. And so we have this system. Now, that's fine if everything is working in a nice and stable fashion. But as you might guess, currently things are a little bit trickier. So here I've in sort of 3 pictures, I've got some of the things that that are I guess trickier at the moment. So in each of these 3 graphs, the red line would be our expected sales, so our old forecast. And then the blue line might be what's actually happening. So if I start on the graph on the bottom right, so this might be, for example, the actual sales we're now seeing for something like, say, toilet rolls. At the beginning of the pandemic and just before the lockdown, people realized there would be a lockdown at some point and did massive amounts of buying. And you kind of had the panic buying region where suddenly our sales were much higher than expected. Then after a little while, as you know, in the case of toilet rolls, for example, the stock was actually lower, so people couldn't pick it up. For other items, it might just be that they didn't particularly want to go into a grocery store and were kind of, unused to the idea, and this kind of slightly, I guess people were more worried about going out to their homes and stuff like this. And so there could be a dip. And then after that, actually, there might even be increased sales over time. So there's a lot of items where where actually sales have shifted into Tesco from other places. So a good example would be pubs are currently closed. So people will be more likely to be drinking at home rather than going out to the pub. And so for that, they would go to Tesco. Or again, if in the case of toilet rolls, you're no longer at work all day, so you actually need more toilet roll at home. Another example in the middle graph, it would be actually the case where people have a fundamental change of behaviour of how they're shopping. So one example would be you, on a normal working day, you might happily pop into a Tesco store and pick up some kind of quick meal. Just maybe one of the meal deals or something like that. Packed sandwiches and things. Whereas nowadays, people at home, they're more likely to actually just go out and buy bread and cheese because they're at home during lunch, so that they can make their own lunch. So then you end up with the sales of those kind of packaged lunches, if you like, just heavily falling, and then slowly over time, maybe as things start to open under lockdown, then things kind of slowly maybe going closer back towards the normal levels you expect. And then finally, on the left, so I guess moved in the backwards, or you could imagine that this might be the sales of, say, grocery home shopping. So Tesco over the I think within a month or so, maybe a couple of months after the lockdown happened, managed to double the amount of orders that were coming out that were being delivered by grocery home shopping. So you'll just get at that point, you're just going into a whole new regime of where the demand is much higher than the supply, and you're having to ramp up your operations to meet that demand, and going into something very different. So what do we do about all of this? Well, the reality being, of course, that mostly with forecasting, you're relying on there having been something that's happened in the past that you can relate to, and then you're especially with the kind of the statistical or pattern recognition type methods that we have been able to rely on in the past, that doesn't necessarily work so well when you've got something where you basically haven't seen it like this before. So what we end up doing is, of course, relying much more on scenario planning and kind of trying to work out from, let's say, like the Imperial College London, we're bringing out a whole set of kind of scenarios right back at the beginning of, these are possible ways in which the pandemic might look like over the next few months. So you can kind of use those scenarios to try and work out, okay, well, how do I believe things will get back to normal? Do we expect everything to, like lockdown isn't really an on or off, I think, as we're realizing. Everything's slowly happening. Pubs are, for example, slowly opening, but they're not probably opening at full capacity. Will everybody actually be happy to go back? And this just has to come through judgmental assumptions that you make. The way I've been starting to think about this, so as I said, I'm concerned with this kind of 2 months and out to a year. How do we deal with that? And so the way I've been thinking about how we might make those forecasts going forwards is by splitting my the way I'm thinking about the time series into regions. Now, the first region, I'm kind of thinking of the initial shock. So this would be the panic buying, where just lots of basically people were doing their big stock up. They were getting used to the idea of what lockdown even meant. and so you had just the reasonably short period in terms of these timescales of just completely different behaviour. So on the graph, that would be sort of like 0 to, I don't know, 6-7 weeks or something. Then there's actually a new normal where, well, I say normal, a temporary normal where you're in whatever normal is for lockdown. And so that's kind of where we kind of currently are. And then what you expect to happen in the future is actually that we need to transition back to a new normal, whatever that new normal is. And what I mean by that is that what we transition back to may not be what we saw before COVID started. Will, you know, for example, grocery home shopping, will more people stay doing online shopping now that they've got used to the idea, and that there are more spaces available for them to do so? So you don't necessarily, you know, will people carry on getting meal deals and go back to that, or will they actually get used to the idea of making their own sandwiches? Maybe seems kind of silly little things, but actually in terms of kind of making these forecasts of these types of products, quite important. And then afterwards, we have a region of stable forecasting, where we actually still have the trouble of this. If you're basing your forecast off patterns that have happened in the past, this year, how do you deal with this year and make sure that you've trended back to the correct place? So these are the things that I guess I've been thinking about and trying to work out how to deal with. Mainly, I think that the place that I'm really starting from is as far as getting back to some form of normal, the last point of reference we have is pre-COVID. So if I was to make a forecast from pre-COVID, that is where I, in the end, expect to get back to nearly. And then again, I have to go through that scenario planning thing of saying, well, actually, people are going to make scenarios long term now to say, well, I expect grocery home shopping to go to this level, so we can maybe adjust our previous experience to give what we expect the new normal to be. And then we have to adjust, and then we have to kind of build this transition period between those two regions. Again, this has to happen with scenario planning. And then finally, basically the next part of the job after that is to say, okay, we've taken all that information, let's encode it, so that rather than every week people having to, you know, that they now, if you've now worked out the mechanism by which you're going to create your forecasts, you might as well encode it so that the data can continue to update the forecast automatically, rather than people having to continually manipulate the forecast that they're making, if that makes sense. Yeah, so you don't want people with Excel spreadsheets all the time kind of messing around with their numbers. You want to have kind of taken their insights and turned that back into the automated process that you had to start with, which is, of course, as I said, that's the process. That's what you need to happen, because then you have that proper interaction with people again, and you've got your system being the thing by which you look after your forecasts. And yes, that's my talk.
Okay, fantastic. Thanks, Trevor. Bang on time. So we're at about 10 to 3, which means that for the panel, we're probably going to go over a little bit anyways. But I think that's okay. It's worth it to get to hear these talks and then to have a few questions. So I think we still have time to take 1 or 2 questions for Trevor. So over to the audience. If anyone has a question, would like to ask directly of Trevor.
Can I ask a question, Devin?
Yeah, go for it, Bauman.
Maybe, 2 short questions. So we have seen in the graphs you just presented the forecast as a point forecast. My question is, do you also consider uncertainties around the forecast that helps you with the decisions you're making? Or is it just the point forecast that you're using for your decision making? And the second,
yeah, currently it's a point forecast. I think for these long-term ones, before now, basically, for these long-term forecasts, the necessity of having understanding the distribution wasn't particularly important for actually running operations. so we hadn't, but yeah.
Yeah, thanks. And then can I ask a second question related to COVID? Because when you talk about the regions, so and from the initial, to new normal and etc., do you classify also the products? Because I suppose the COVID has different impact on different products. It suppressed the normal demand for some products, increase it for others, and probably for some products it remains unchanged.
Yeah, I think as long as you can. I think almost for me, almost as long as you know how to classify the time scale for each of those parts for each of the products, you're okay, because you can sort of let the model work out. Okay, it's had a drop. Let's say that you did a kind of a change point analysis, for example, and you go from some normal dropped down to something else. Your change point analysis can work that out as long as it knows where it should be trying to look for that. So if it goes up or down, I'm not too worried as long as I know how to kind of classify what method I should be using in each region.
Okay, thanks a lot for that, Barman. Jeffro, you've got your hands up. Yeah, you've got a question?
Yeah, thanks, Trevor. Really interesting talk. I guess it kind of follows on from Barman's question about classification. I was wondering if there are opportunities here for some kind of transfer learning, either kind of across products, as you get more data, or even spatially as you see behavior in one region of the country propagate spatially.
I think honestly the answer probably is probably, but actually expanding the system enough to be able to do that might, whether it'd get done in time or not, I don't know.
Cool, thanks.
Okay, I'll take one more question.
Devin, could I butt in?
Yes.
Trevor, I missed, perhaps you told us what level of aggregation you're actually forecasting.
Yeah, so we're actually worried here. So I said we had the store forecasts, and we're worried about groups of products, but we're actually worried about them separately. So we make sure they kind of align when you get to the top numbers, but as kind of where. So if I don't know if a store's got something like not exactly, it's like 50,000 products that we're splitting that that's aggregated up to about 4,000 groups. Is kind of the level. So 10 products per group type thing. So
that's quite manpower intensive.
Well, hence why you do it with a why we want to do it with a system rather than.
Oh yeah, sure, yeah. But I thought you were making judgments about the perhaps the product categories rather than detail.
We can do basically. We have the ability to take the adjustments and then flow them down as well. While maybe that's not ideal, effectively we can take it wherever people can provide the data, and we'll do our best to flow that down to the more granular levels.
Yeah.
Thanks, Trevor.
Yeah, Devin, I've got a question if there's time for one more.
Sure, go for it.
Well, I mean, I'm just thinking from the area where myself and Jethro and Bruce work really on it, which is in energy systems. We often have to look at other people's scenarios really, and then try and actually equate them with how the energy system is operating. And quite often, I mean, they're developed with people with domain expertise in their domains, but they don't necessarily read across directly, or they seem like they'll fit, but they don't really fit very well. And I wonder to what extent were these external scenarios useful to you as they were? Or have you decided now that you need to be able to do that in-house and do a bit better job, because you can understand the business, whereas maybe some of these external sources do not?
So there were, so I say the imperial stuff was very much about, as I guess at a national level, where you expected things like the peak of the virus to be, and I don't know if I don't know if it was explicitly how long lockdown would go on for, but it was certainly kind of where they expected the peaks to be and stuff like that. And at that point, I think you have then internal groups who understand the business that take that and turn that into, I expect this to happen as a result. So it was it's an amalgamation of both.
I understand. Thank you.
Okay, thanks a lot, guys. Well, there's still a little bit of time for some more discussion. Jeffro, in terms of could we go for another sort of 15 minutes, so 3 into your quiz time? Yeah, yeah, I think given the level of discussion and that we want to have the Q&A. So for the Q&A, obviously, I want to just start it off by having a question directed at each of our panelists. So the panelists consist of, obviously, you've heard from Jurgen, you've just heard from Trevor, and as I mentioned, we've got Jennifer Castle, who I think also works with Jurgen, who's also based out of Oxford, and who is going to sit on the panel. The idea behind this, hi Jennifer, thanks for coming on that. Yeah, so the idea behind this short segment was just to pose some questions around, as forecasters, the role of forecasting within this scenario that we're in. And I think our presenters have responded to that to some extent already. But I would like to kick the panel off by asking each of them to respond to what they perceive as, very simply, the role of forecasting, both from a research and a practice perspective in relation to COVID-19. And I will get, since Jennifer hasn't spoken just as yet, I will get Jennifer, hopefully it's not too much pressure, but I'll get her to kick us off in that response. Yeah.
Hello, thank you very much for inviting me to join the panel, and I really enjoyed the two presentations, so thank you to both of them. So that's a rather broad question, what's the role of forecasting? I think clearly it's absolutely essential to have useful, accurate, robust forecasts for all forms of planning, resource allocation, and various policy implementation. I know there's been a bit of discussion through the International Institute of Forecasters blog with Taleb arguing that we shouldn't be making point forecasts, and I think that's completely wrong. We really do need point forecasts for how the pandemic is evolving in order to ensure that we can think about how policy is implemented, how we can allocate resources, etc. I think one of the advantages, well, there are no advantages of this, but one of the things it has brought to light is very interesting types of data for forecasters to work on. You look at the data that Jurgen presented, it's really quite dramatic data. We tend to think of data as falling into stationary or non-stationary categories. And most people tend to think of non-stationary data as essentially having some kind of unit root, and is therefore can be adjusted to some kind of stationarity. And indeed, we have some kind of structural breaks or shocks as well. But if you look at the data on cumulative cases, we really see very highly non-stationary data that contains stochastic trends, structural breaks, measurement error, all of these kind of things that forecasters worry about. And I think it's the kind of data that we can put all of our methods to good use and really try and learn something about how our methods work on data sets that are very non-standard.
Okay, thank you very much. Okay, so Jurgen, would you like to share your perspective, and then we'll get Trevor going next. Thanks, Jennifer.
Yes, I'm afraid I don't have very much to add to Jenny because I very much agree. But I can add a personal anecdote that forecasts can be useful at very many levels. Is that the reason I started forecasting, and I picked it up together with Jenny and David on the 15th of March, is that I have an 18-year-old daughter who was preparing for her A-level exams, and she was asking me about every 10 minutes, what's going to happen next? Am I going to do my exams? What's happening? Is my summer ruined? And of course, these are, for her, very big issues. In the grand scheme of things, they are not big issues. But again, I mean, it's something where you need forecasts to make to kind of give some reasonable answer to these types of questions. And I think on that day, that was a week before lockdown, clearly that lockdown decision was a very important decision that had to be made, and it will be debated for quite a long time whether it was made at the right time or not. but without forecasts, that's really would have been very much harder, I think.
Okay, thanks a lot, Jurgen. Trevor, over to you. I mean, from a practical perspective, you know, you're working at Tesco. You guys have to deal with this stuff. I love the different sort of toy time series you showed, but they were rather effective because at the end of the day, they showed us the type of data and the type of behavior you guys were observing. So, I mean, where do you see forecasting having to deal with it to respond to very directly in a planning way to the problem, to the challenge of COVID-19?
Yeah, well, I guess, I mean, in industry in general, right, you have your forecast should be driving your business as to understanding, you know, what you need to do next. So for Tesco, as I said, while I don't particularly work on it, you've got the supply chain who need to make sure that they're getting in the right amount of food. You don't want to buy too much or too little. You want to make sure customers can get the things they need, but you don't want to waste things. And I guess that even the wastage even is a particularly I guess highlighted at the moment as people with environmental concerns as well. And then you have just making sure that your operations are running long term as well. And it's kind of it's built into the way that we, you know, the starting point for all sorts of planning across the whole business, really. So it's just something that we have no choice but to try and work this out and get the best forecast we can.
So just to follow up on that, Trevor, so currently these, I think you mentioned you're forecasting really for the sales team or to inform long term. And the idea is that what you're currently doing now is what going to influence what Tesco does, what, the next couple of months going ahead, or?
Yeah, so it's, as I said, they're used for example, for things like payroll in stores, or planning out strategies for the next year. So if you've got a forecast of your of how your business is doing over the next year, for example, then you can use that for working out marketing and stuff as well to kind of work out, you know, where you would like to improve parts of your sales or whatever you want to do. So it's kind of used for those things.
Okay. Well, that was just to sort of introduce the panel. So I'd like to open up questions to anyone else. If you want to type H, so we can do it in an organized way, use the chat area. Type H, meaning your hand is up, and I will then direct a question from you. The idea is that we have some debate now around, you know, use of forecasting, role of forecasting, research. Just as Jennifer said, it's a wide area, but I'm willing to cast that net and see what questions we get. So any questions? I don't see any hands up just yet.
I'll do this.
Yeah, Barman, well, you're here, so you might as well go for it.
Sorry, yeah, thank you, Devin. So I have a question maybe for Jurgen or Jennifer. So, I mean, we have seen so many different forecasting models when it came to forecasting the outcome with COVID-19. So in one case, Nicholas Reich, he developed a dashboard when instead of using one method, he's combining 35 different models. And as a decision maker, I suppose, decision makers or policy makers at some point, they will be confused which model they have to use because there are so many different models. So do you see this ensemble forecasting as a way to overcome this issue? Because I heard from decision makers across NHS, they don't know which model they have to trust in.
Do you want to go, Jen?
Yep, go on.
Shall I respond to start?
Yeah. Yes.
Okay.
You're unmuted.
I think there's quite strong evidence in many of these forecasting competitions that actually taking averages across all of these models tends to deliver a good forecast. Now, it's never going to be the best forecast because you're averaging across many different models, but it gets you in the ballpark of the non-poor forecasts, as long as you're averaging across reasonable forecasts. So I think the strategy for these time series models of averaging across many different types of forecasts tends to work well. That's quite a different type of question to how we can use models to conduct policy. And I agree that many of these forecasting models are not designed to be models that can tell you whether one should conduct policy or not. These are purely extrapolative forecasting methods. And in those situations, I think averaging does seem to work very well. I don't know whether Jurgen's got different views.
No, I agree. And we actually, within our forecast, the forecast that we report on our website, there are averages. And one of the ones, the black line, if you remember, that I showed, is an average of recent forecast. And indeed, averaging seems to be very helpful. The only problem, of course, is that you have to ideally avoid adding, as David Henry would say, adding something poisonous into the mix that really makes everything, the average, very bad. And I think during the period of exponential growth, I think the time series methods, like the kind of extrapolative methods that we use, forecasted very much better, I think, than the more structural models. So ideally, you would not have included them, or you would have downweighted them in the average. The difficulty is that you probably only know this after the event, not at the time when you produce the forecasts. But during that period when those models went relatively badly, of course, that meant that all the outputs of those models were much more in doubt as well.
Okay, thanks a lot, Jurgen. So we've got a question from Rich Snowden. Feel free to pose your question.
Hi there, yeah, I'm Rich. I was just wondering, particularly with some of the topics discussed in Trevor's talk there, with the current situation being very much an anomaly, but also the potential to reoccur if there's another wave in the future, how much would this current outbreak be useful as a reference for any further outbreak, or would it potentially be just another thing that's of its own thing and not particularly relevant?
Yeah, I mean, I'd almost be tempted to say that what's happened over March and April wouldn't be helpful for a second peak, but would only be helpful if you literally started again. So if in 10 years' time this happened again, because no, but in the sense that do you expect people's behaviour to go into exactly the same mode of panic buying in the shops, or not? Because that's effectively where it hits Tesco, right? I think certainly if you're talking about lockdown, like levels of lockdown, that feels like actually you can learn from the past because you've seen how people behaved at various levels of lockdown. So that feels useful. But in terms of kind of thinking about that kind of initial period of panic buying, I don't know actually if that would be useful or not.
Yeah, I was just wondering because
go on, Rich. Yeah.
A lot of what we're going through at the moment feels like we're going through a learning process on how to respond. And as you say, if it happened again, we wouldn't need to relearn if it's relatively recent. But...
Okay, Jurgen or Jennifer, would you guys like to pitch in? Yeah.
Yeah, you can, because there is a kind of endogeneity there, because if you can convince everybody that your models are so good, your forecasting models are so good that there's no need for panic buying, then there will be no panic buying. So then you don't need your models, your forecasting models in some sense. So it's always going to be quite tricky.
Okay. Yeah, I think that's really interesting. I think in particular for you, Trevor, because probably, God forbid, you might have to face that very question at some point in time, and then having to decide, how to contextualize this current situation and whether it's useful going forward. Robert, you've got your hands up. You've got a question. Maybe your mic is on mute. I'm not sure, but we're not hearing you.
It's okay. I was just trying to find the mic. You can even expose my face as well. Both presentations, and I've already asked about the issue of lead time, but both presentations present that. I mean, I'm not convinced Jurgen, that and Jennifer, that a one period ahead is a sensible, helpful lead time, but it certainly isn't either for Trevor. And we do know that linear-ish models will work fairly well one period ahead, but they're not necessarily good for getting the turning points, which are pretty important in policy terms here. And same with Trevor, where effectively return to normality. Yes, well, we're all waiting, aren't we? Boris Johnson has been promising it. Well, we all know what that's worth. So anyway, lead times then, and getting those really important turning points. Your thoughts?
So who would like to volunteer? I think Robert's main question is around relevance of lead time and turning points, importance for policy, and so on.
Yeah, maybe I can start. Yes, we do 7 days ahead, which actually during a period of exponential growth, I think is quite a long way ahead, even though it's only 1 week. But as far as I'm aware, none of the models in use would have been successful in predicting the turning points, because those models that went much worse during the exponential growth put the turning point at some faraway place, either very nearby or very far in the future. And that is why we could have estimates like some were coming out with 60,000 deaths, others were coming out with 6,000 deaths. We had this wide range of forecasts because it is very difficult to predict that turning point. And I think that will be a very interesting research question to try to find methods that could help us with that without generating very wild forecasts.
I can comment. I think for me, actually, the important thing is maybe not necessarily if you've managed to get a good forecasting method that can deal with the turning points, but that if you can do your scenario planning in such a way that you found that you can make sure that your operations will deal with certainly the most likely scenarios, and then pushing out as far as you can, then that for me feels the important thing. At some point you have to kind of, it feels like you have to accept that your forecasts are not going to be as good as they were, a few months ago. So then it comes down to, okay, can I run my operations? What things might I have to worry about, and almost rely more on the scenario planning than forecasting. But that would be my take.
Perhaps I could come in here as well, slightly tangentially, but relating to the previous question as well, that in terms of Trevor's forecast, it seems as though the way the pandemic is going to be handled in future is looking at more localized lockdowns and trying to put a hold on the virus where they see local cases rising. And so I wonder if the sort of disaggregation across the sort of geographical level is going to be very important in your forecasts, if that's how it's going to be responded to in future.
Okay, so thank you all. We're out of time, unfortunately. I think we're just touching on some important issues around, I think Trevor has mentioned a number of times, this idea of scenario planning, obviously the discussion around lead time, level of aggregation. As Jennifer just pointed out, it's looking like there's going to be more localized responses to outbreaks and other things like that, now that the government and everyone else appears in a better position to respond, or at least we're more trained than we previously were. And so I think this is a good time to end this part of the segment. I'm going to stop the recording. Before I do that, let me just officially thank on the record all of our speakers, Jurgen, Trevor, Jennifer, excellent talks, and thank you for taking part in the Q&A panel. I believe it was all very rewarding. So as I stop the